Hello, everyone. Welcome to another episode of Infinite Insights, where we analyze the most relevant events in the global political, economic, and geostrategic landscape. Today, we bring you urgent news that is drawing attention from health experts and the international community. A viral outbreak in China that is causing chaos in hospitals and raising concerns about its severity. Let's dive into the details. What is happening in China? In recent weeks, China has been experiencing a massive outbreak of respiratory infections, overwhelming hospitals, especially pediatric units. Videos and reports on social media show long lines of patients, many of them young children, receiving treatment under precarious conditions. Crematoriums in some regions report increased demand, evoking memories of the most critical phases of the COVID-19 pandemic. The situation is so alarming that images of overcrowded hospitals are resonating in other countries, increasing pressure on Chinese authorities to ensure transparency. What is HMPV? The outbreak has been linked to the Human Metapneumovirus, HMPV, a respiratory virus first identified in 2001. While HMPV is widely known to cause mild symptoms such as coughing, fever, and nasal congestion, it can lead to severe complications, particularly among vulnerable groups like young children. Those under 5 years old are often more severely affected. Elderly people, individuals over 65 are at a higher risk of developing pneumonia. Immunocompromised individuals, those with chronic illnesses or undergoing immunosuppressive treatments. HMPV is transmitted through respiratory droplets, similar to the flu and respiratory syncytial virus, RSV. So far, there is no vaccine or specific antiviral treatment for HMPV. Management typically involves respiratory support and symptom relief. What do we know about the current situation? Confirmed data. Increase in respiratory cases. According to China's Center for Disease Control, CDC, 30% of tests conducted have returned positive for the flu, while 14% of hospitalized cases are linked to the respiratory outbreak. Impact in northern regions. Northern provinces in China have been the hardest hit, with respiratory illnesses accounting for 7.2% of outpatient visits, a significant increase compared to previous weeks. Overburdened crematoriums. Some funeral homes report constant queues and high demand, suggesting the number of deaths may be higher than officially reported. Local reports. Farmers in Hunan province described an increase in deaths across all age groups. Funeral directors in cities like Wuhan and Beijing reported chaotic conditions, with bodies being cremated at a continuous pace. Why does this resemble the start of COVID-19? Many analysts draw parallels between this outbreak and the onset of the COVID-19 pandemic in 2019. During the winter of 2022 to 2023, China saw a surge in pneumonia cases after prolonged lockdowns, largely due to reduced collective immunity. Now, with memories of the pandemic still fresh, there is a climate of mistrust regarding the Chinese government's transparency. Experts warn that the current outbreak may be exacerbated by factors such as reduced immunity. After years of strict COVID-19 restrictions, many people have weakened immunity to common respiratory infections. Overburdened healthcare system. Even before the outbreak, Chinese hospitals frequently faced overcrowding. The surge in respiratory cases only amplifies this crisis. Response from Chinese authorities. The Chinese government has adopted a cautious stance, stating that respiratory infections tend to peak during winter. In a press briefing, the Ministry of Foreign Affairs described the outbreak as manageable and emphasized that hospitals are prepared to handle the increased demand. However, the official response has done little to reassure the population. Beijing has not issued public health alerts. There is no official confirmation about the severity of the outbreak or whether it is exclusively caused by HMPV. International impact. The outbreak in China has already begun to raise global concerns. India. 2 infants recently tested positive for HMPV. Although Indian authorities claim there is no direct connection to the Chinese outbreak, surveillance has been intensified in regions near the border. Hong Kong. Small clusters of HMPV have been identified, and local authorities are closely monitoring new cases. International experts, including the World Health Organization, WHO, have yet to issue specific alerts, but the medical community remains on high alert to prevent cross-border spread. Although HMPV is not a new virus and most cases result in mild symptoms, the situation in China serves as a reminder of the fragility of healthcare systems during crises. This outbreak also underscores the need for continuous vigilance, greater transparency, and international cooperation to prevent localized situations from escalating into global emergencies. For now, the best approach is caution. We will continue to monitor developments closely and provide you with updated information. Don't forget to like, share, and subscribe to stay informed with the most comprehensive analyses here at Infinite Insights. See you next time.